Health correspondent Nicola who joins us from London. Nicola, this is just really confusing. What's the situation now with hydroxychloroquine?
It is confusing, isn't it, Rachel? And I think it's a drug that, before the beginning of this year, most of us had never even heard of. It's an anti-malarial used to either prevent or treat malaria or to work against the autoimmune diseases, lupus and rheumatoid arthritis. And that's why they started looking at it to see if it worked with patients who had COVID-19 and ended up in hospital with a cytokine storm and their immune system began to explode and go into overdrive. So because of this, and because of the anecdotal evidence from various doctors who were trying it in hospitals and saying, look, this actually seems to be quite effective. And we've had doctors on TRT World saying in Turkey that it's been useful. So the WHO included it into its Solidarity trial, which is a trial looking at 4 potential treatments. And these are randomised controlled trials. And this is what's so important, is that the trial that's been going on worldwide, run by the WHO and one run by other companies, and also the recovery trial in the UK, a randomised control trial has 2 groups of people. It has a group of people who have basically very similar characteristics. So they're at the same progression with the disease, they've got similar underlying health issues, similar ages, ethnicity, and one group are given the drug, hydroxychloroquine, and one group are given a placebo. And that's what doctors are saying is the only way we can really find out whether this drug works. Now, as you said, the WHO suspended the trials because of this study that was published in the Lancet. That study was an observational study. It looked at a massive database, and there's now questions about the veracity of the database, questions about the veracity of its conclusions, which is why the Lancet's withdrawn the study, which has left everybody with all this confusion. So the trials the WHO are running are now back on, and you've got doctors saying, oh, for goodness sake, let's just get the results. Let's find out once and for all, does hydroxychloroquine work? Should we be giving it to patients?
So what's been the reaction to all of this?
Quite a lot of frustration, really. A lot of very prestigious doctors in the UK and elsewhere have actually said what's happened with this Lancet study has slightly questioned the faith that people have in the work that's being carried out. I mean, we've had on TRT World, I know you were speaking earlier today with one doctor sort of saying, is the science moving too fast? I mean, we're desperately trying to find a potential treatment for COVID-19. We want to know how patients can be treated. But I mean, I, as a health journalist, I receive information about studies. I received one last night that was a study on just 10 people. Now, is that likely going to be an effective study or not? We don't know. You've got a lot of these very, very well-respected doctors who were frustrated by what's happened over this Lancet publication, then withdrawal. They felt that the trial shouldn't have been stopped because they're worried now that they're going to have difficulty recruiting patients, whether it's because patients have lost faith or because the numbers, of course, are diminishing as lockdown procedures are coming into place. So there is a real fear that this will have an impact on both people's faith in some of these studies, faith in the trials, and the possibility of us being able to find out soon how effective hydroxychloroquine really is.
All right, Nicola, thank you.